What are the early symptoms of bone TB? Imagine a slow, creeping discomfort that starts in your bones or joints without a clear reason. That's often how bone tuberculosis begins. The earliest signs are usually very subtle and develop gradually, which can make it tricky to spot early on. One of the most common initial symptoms is persistent pain localized to the affected bone or joint. This pain tends to worsen over time and may not be sharp but feels more like a dull ache that lingers. Sometimes, you might notice mild swelling or inflammation around the area, which can be tender to touch. Stiffness and reduced movement in nearby joints are also common early signs, especially if the spine or hips are involved. In addition to localized symptoms, some people experience general systemic symptoms. These include low-grade fever, which is a mild fever that comes and goes, feeling unusually tired or fatigued, a loss of appetite, night sweats, and unintentional weight loss. However, these symptoms are less specific to bone tuberculosis and can be seen in many other conditions. It's important to note that in the early stages, bone TB may cause little or no pain at all, which can delay diagnosis. For example, spinal tuberculosis, also called Pott's disease, may initially cause back pain and stiffness without obvious signs of infection or swelling. As the disease progresses, symptoms tend to become more severe. Swelling, abscess formation, and even neurological symptoms like weakness or paralysis can develop if the infection spreads or affects the spine. Deformities may also occur over time. Because these symptoms overlap with other musculoskeletal problems and tend to appear slowly, doctors often relying on imaging tests like X-rays or MRI scans, along with laboratory tests, to confirm the presence of Mycobacterium tuberculosis. If you notice persistent bone or joint pain, swelling, stiffness, or systemic symptoms like fatigue and low-grade fever, especially if you have risk factors for tuberculosis, it's essential to seek medical advice promptly. Early diagnosis and treatment are key to preventing serious complications and ensuring the best possible outcome. Remember, always consult healthcare professionals for personalized evaluation and care.